President Trump, meanwhile, has officially taken steps to withdraw the U.S. from the World Health Organization today. But there was important news from that organization, and it comes amid pressure from hundreds of scientists and doctors around the world who believe that tiny virus particles can actually linger in the air far longer than many have acknowledged. And so ABC's Eva Pilgrim tonight on just how long those particles could be in the air.
Tonight, the World Health Organization for the first time acknowledging it may be possible that COVID-19 could spread through the air more easily than we knew.
We acknowledge that there is emerging evidence in this field.
239 scientists from 32 countries put pressure on the WHO to change its current guidance. We have long known that the virus can spread, as you see in this video, by large droplets that are only in the air for minutes. Those droplets can come from coughs or sneezes, or even talking loudly, singing, or heavy breathing. These scientists now say this virus may be able to stay in the air much longer in much smaller, tiny aerosolized particles. Those particles could potentially get caught up in the circulation system of a room.
It's a problem in indoor environments, so in buildings and rooms where the ventilation is poor and virus can build up, especially if there's lots of people in the room.
Look at this study out of China. A woman went to a restaurant before showing any symptoms. Less than 2 weeks later, 9 other people got the virus, 5 who were not seated at her table. Some of the people who got sick were more than 15 feet away. In Washington State, Tony Reyes was one of 14 customers testing positive after going to this East Vancouver bar. 4 employees also sick.
Eventually, they said, we're going to have to move you into ICU. Don't be naive. This virus is no joke.
He's since recovered, but cases tied to restaurants and bars have pushed several cities and states to roll back openings at indoor businesses. Today, Dr. Anthony Fauci, the country's chief infectious disease expert, said he thinks governors in states with surging cases should mandate masks to prevent outbreaks.
Masking, distancing, washing hands, closing bars. If you do that, I think it'll be a giant step towards interfering with the spread in your community.
All right, so let's get right to Eva Pilgrim tonight. And Eva, we just heard Dr. Fauci talk about the importance of wearing a mask. I know you spoke to one of the scientists raising the alarm with the World Health Organization. That scientist telling you wear masks indoors, even in public places where they've done social distancing, like restaurants that have put tables far apart. They said wear masks anyway.
Yes, David, and this is why one study suggesting that these particles can linger in the air for as long as 16 hours in a lab setting. Dr. Fauci and Dr. Marr say this reiterates why it's so important to wear a mask, especially indoors, even when social distancing. David.
And it just reminds us that there is still so much we do not know months into this. Eva, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.